Well, good morning on a Monday. Hope you had a fabulous weekend. And actually, some of you may have even had the last 4 or 5 days off if we include the holiday. We'll talk a little bit about our 4th of July and how much fun we had at Defiance Ridge Vineyards with Ruby Lee. We were thrilled to be able to bring her out and have a good majority of our team that was there enjoying that concert as well. I hope you had a fabulous one and that nobody was injured. I know a lot of people were out there doing their own fireworks, but I asked you last week, and we'll ask you each and every year, leave it to the professionals to try to keep yourself safe. Again, hope you had a wonderful one. The weather definitely has been up and down, not just here, but all across our nation. I was driving in listening to CBS News this morning, and they were talking about this June being one of the hottest on record all across the United States and the flooding issues that so many are experiencing. So we're going to start with weather. We've got a little bit of news and sports, and then we're going to get right into today's topic, which has to do with tick-borne illnesses and the prevalence of the on-the-rise of alpha-gal syndrome. Now, I actually introduced you to that last year. A dear friend of mine was diagnosed with that. We'll tell you what alpha-gal is all about, Lone Star tick disease, other things that are out there as you are out walking and running and maybe hiking. What should you be putting on to prevent this? And if you have it, what you need to do immediately so that there aren't long-term implications. So we'll talk about all that. But let's kick things off, first of all, with our What the Weather segment.
Alrighty, welcome back into this new more weather forecast video. This one has been looking significant for a couple of days. So
good morning to you.
Good morning, Monica.
Finally.
Nice to be here.
As you see, our aspiring meteorologist, Beckett Moore, he's been on with us since January, and I've been talking about how incredible he is. I know you all love him. Let's say good morning to him. He's in Illinois this morning. Good morning, Beckett.
Good morning.
yeah, good morning.
Now, this is exactly what we were showing you last Friday. In fact, a picture we had showed the before and after of those ball fields right near where Beckett is. So, Grafton, Illinois, I was telling you that I went over the weekend, and we've got some video that we can show of all the debris that's in the water and the cresting aspect of it as well, Beckett. So, this is supposed to crest, what, is it by Wednesday?
When's it supposed to crest?
It's going to crest as we go into the next couple. Right now we're at around 22 feet here. Now, when we last came on, it was forecasted to crest of around 26 feet, but that has since gone down. The forecast has gone down and it's supposed to crest. Right now it's at about 22.5, around 22.7 right now, and that rain we're expected in these next couple of days is going to make it go up just a little bit. The forecast actually just changed, and we're seeing it go up just a little bit these next couple of days from the remnants of Hurricane Beryl. That's going to bring rain into the area and possibly a flash flooding threat as well.
And it's crazy to think, if you go back to 1993 and the flooding of 93 and just how horrific that was for so many in our area, those were in the almost near 40. It was like 36 or 38, I believe, which is unbelievable to think that we're talking about the flooding you're already seeing, but just how high it was back in 93. You know, I was mentioning, I've got a video that I'll have Zach show here for you of the debris in Grafton. This is right at the boathouse. And as I pan out, this is the reason we never got on the water, because there was a lot of debris, all of that washing up on shore. There were buoys that were going by. There were tons of people out there on wave runners and boats, but we were not going to try to dodge it because that's where it can get really dangerous. And I know they had a lot of the ferries that were shut down as well for St. Charles trying to get over into that area. So from what you saw on Friday when you were on with me to today, how much worse would you say that it is, Beckett?
How much worse is it now compared to Friday?
It's about 1 foot higher from Friday. So about right here is where we were standing yesterday, and now it's pushed up just a little bit, but thankfully that forecast has gone down, as we've seen, from 26 feet here to around 22.7 feet now as the final crest. So we're likely not going to see effects on Main Street or for most of Grafton, so it won't be as big of a deal as it was once forecasted to be.
So I was mentioning that there's a majority of the nation dealing with flooding, as you can see where Beckett is. And if you watched him on Friday, you can see just how much more water he's standing in. But Beckett, I mentioned to you this morning in a text that it's also the extreme temperatures. Las Vegas, did they hit 120 yesterday?
Did Vegas hit 120 yesterday?
Yeah, they did, and it's very hot right now, and that's actually the record for their city. That's the warmest, hottest temperature they've ever recorded there.
Unbelievable. Yeah. So depending on where you are throughout the country, different things that you're dealing with. All right, let's take a look at what we're expecting for today. I know tomorrow and Wednesday, the effects of Hurricane Beryl, which now is what? It's about 100 miles away from Houston?
From Houston is Beryl.
It's actually coming into Houston right now. Those rain bands are coming in. Made landfall onshore at around 4 a.m. with 80-mile-per-hour winds, and it was a Category 1, and that's going to likely bring some flooding to the Houston area and strong winds.
And so what we're expecting on Tuesday and Wednesday would be some of the effects of that. We've got some rain heading into our area. If you can give us the next 7-day look.
7 day.
Okay, so today we got a high of around 90 degrees, possibly a couple storms as we go into this afternoon, but the bigger threat for those will be to our south. Tomorrow we really cool off, high of 77, feeling more like spring. We are going to have a lot of heavy rain tomorrow and possibly a flash flooding threat as the remnants of Beryl come through the area. That's going to bring a lot of training of rain, so we're going to be having to watch that flooding threat across the city very closely. Wednesday, 85 with more rain around, and the rest of the week, Thursday, Friday, Saturday, highs around where they should be this year, around 90 degrees.
All right, Beckett, again, phenomenal reporting out in the field, again, from the Grafton, Illinois area. Just be careful. We'll continue to monitor this and bring you the latest on the weather as well. Beckett, thank you so much and be safe.
Thank you.
All right, that's aspiring meteorologist Beckett Moore with our What the Weather segment. We're talking about Hurricane Beryl. We'll continue to monitor that for you. Nice to see that it is lessened because it did an extreme amount of damage. I don't know if you saw all that in the Jamaica area. We talked about the portions that were hit earlier last week, but now monitoring how it will affect us. Besides that aspect, also talking about something that's more fun for our lovers of the arts, the Muni. Tonight, there's an opening for those that enjoy The Little Mermaid. Disney's The Little Mermaid, actually one of the most well-attended shows, they said, at the Muni. So that opens up tonight, and that will go through July 16th. If you're looking to see something, look how cute that is. I absolutely love that. And the cool thing is they incorporate some local people. So I know there's a young girl that is in this that is super, super thrilled, like doing the flounder, I believe, that's in Disney's The Little Mermaid. So again, July 8th to the 16th, this is the family show. There's always a good family show. And they've had incredible crowds for the first two. We had a chance to open up and see Les Miserables, and then Dreamgirls, and now The Little Mermaid. Next, by the way, will be Fiddler on the Roof, which is always a crowd favorite as well. In sports news, the Cardinals and St. Louis City SC both in action yesterday. St. Louis Cardinals, we were talking months ago about it looking not good for them, but they are just really, really picking up as we head towards the All-Star break. So the Cardinals, they beat Washington 8-3. Same two teams at 3:05 first pitch this afternoon. St. Louis City SC, unfortunately, on the losing end to Colorado, 4-1. And Roman Burkus, by the way, went out with back spasms. They say it is looking like it's just muscle spasms, so that's good news. City and Vancouver on tap Saturday night at 7:30. Okay, I want to show you a couple things. One had to do with the 4th of July. I hope you all had a wonderful one, and I want to thank all of you that came out to see Ruby Lee. She was in concert on Thursday at Defiance Ridge Vineyards, and we were thrilled to be able to bring her out on stage. Let's do a little recap of this.
For those of you that don't know me, my name is Monica Adams. However, I started a year and a half ago my talk show, which is The Real Monica Adams. And people have asked me the question behind that. We need more real, authentic people in life, do we not?
Well, I hope you all have been doing well. I appreciate you all for coming out here. I know it's kind of hot. Just really thankful that it's not raining right now. So.
She's 17 years old, and you, 500 plus people are here tonight because she can sing.
On the banks of the river, where willows sing now. White birds say over, with love on the sound.
She's just absolutely incredible, and we are so thrilled that she's become a big part of the Real Monica Adams Show. Ruby, you nailed it. I do have to say, for any of you that came out, thank you for sitting through the technical difficulties. There was a 50-minute delay, and for those of you wondering why I was talking so much, I was asked to fill that time. Not 5 minutes, not 10 minutes, but 50 minutes of a delay that we had to do a little song and dance and talk about the show. But hopefully we've got a bunch of new people watching us and listening to us on this show and on our podcast. So thanks so much for coming out. Not only thanks to Ruby Lee and Defiance Ridge Vineyards, but in Westport, there's an experience that I want you to go to. It's called the Rawlings Experience. And today on our set, we are getting a chance to reveal to you what was custom made for us. We have a custom-made blue glove. Look at that. It says Know Your Value, and it's in the true Monica blue. We had the one on the left that was actually made for us the day of the show that we did that says The Real Monica Adams Show, and it's all about knowing your value, right? So we put all those on the gloves. They can custom make these for you, for your kids. In fact, that bat that's on set, I'm told that kids would come around the corner and see the bat and go like that and say, that's it, like almost like the heavens opened up. So there's very few left, limited supply of those bats, these hype bats that you can get for your kids. And I think it's something to do with like this flame bat that they have for the adults. But thank you to Eric and the staff at Westport's Rawlings Experience for doing the custom made for us, for having us out to do the live show. Again, we've got a couple of gloves and bats and batting helmet, and we have a couple of bats actually. The silver bat that we showed on the day of the show, I've got it here on set as well. That one says Know Your Value and Just Be Kind, the Real Monica Adams. So Mobile Monica, it says on the other side of that glove. But how cool is that? Again, all of this can be yours if you go to the Rawlings Experience. And here's the silver one I mentioned. They've got, I think, probably a gold one, but yeah, it says Know Your Value on it. Be kind. So cool. Couldn't wait. I know a lot of you were asking me, did you ever get that custom glove? Well, there you go, that blue one on set. So thank you, and please get out there and support them. Again, it's absolutely free to go to the experience, and then you can buy some of the stuff for your kids, baseball and softball, so that they have something new and something exciting to talk about for their upcoming season. All right, everybody, it is 7:15, and we're going to take a quick break. When we come back, we're going to be talking about something that maybe some of you have never heard of. In fact, there are even doctors out there that it's still kind of new to them. Alpha-gal. We'll also talk about the Lone Star tick syndrome and disease. There are many things that we're seeing more and more. There's a ton of ticks out there. You're probably finding them on yourself and on your dogs. They can be extremely dangerous. In fact, they can be fatal. So we're going to talk about that with Dr. Sarah Jensen with Regional Dermatology. Any questions, any comments you have, drop them throughout the show. I've got Kelsey and Ashlyn with me. They are moderating and making sure that I don't miss any of the comments. Amy is going to be with us. Amy is the patient of Dr. Sarah Jensen, who was diagnosed with alpha-gal syndrome. And then Edward is going to be coming in our second half hour. So we've got Amy Levitz and Edward Boyer as two different patients that have experienced this. And we want to try to prevent this from happening to you. We'll talk about all the tick things, hives, different rashes, things like that you need to know. Again, any questions that you have, we are monitoring those for you. So we'll be back with more right after this.
Be more positive. Yep. You know, the world, and I'm spreading positivity with my air fresheners. So,
you and I both,
yes.
Sir. Sadly, I wasn't aware of the Monica Adams Show until recently, and was I missing out?
I'm definitely going to turn this on in the mornings on our TV.
She's helping people to understand their value. She's helping women to transform their lives.
From the minute that we walked in, I felt just really comfortable and at home here.
You are always a ray of sunshine and positivity.
Thank you for what you do. I love this whole thing that you're doing.
It's good news. It's great news. It's uplifting and empowering.
But you were engaged, and I love that. So thank you so much.
When I started MyPillow, it was just a problem solution, one product company. Well, since then, with the help of my dedicated employees, we now have hundreds of products, some you might not even know about. To get the word out, we're having a $25 extravaganza. 2-pack multi-use My Pillows, $25. My Pillow sandals, $25. And for the first time ever, our 6-pack towel sets, you guessed it, just $25. Our brand new 4-pack dish towels, $25. And I've never done this before. Premium My Pillows with all new Giza fabric, any size, any loft level, even king size for only $25. And there's so much more. So go to mypillow.com or call the number on your screen. Use your promo code for our $25 extravaganza. Order $75 and over. Your entire order ships absolutely free.
Welcome back, 7:18. Thrilled to have you along with us. It's the Real Monica Adams Show. I'm your host, Monica Adams. As I mentioned, we are going to be talking about a lot of things in the next, 45 minutes or so. And I already saw Linda said our best friend has alpha-gal, and I know a couple others suffering from it also. But a lot of you are like, alpha what? I know. Last year, my friend Sally Drake was on this show, and we were talking about it. She was actually diagnosed years ago with it, and she's the first person I had ever heard of it about. And now it's interesting because I had a lady that reached out to me and said that she and her husband were going through this, and she's like, I think it might be a topic you might want to discuss. And then ironic, Dr. Sarah Jensen, who you've met hopefully over the last couple of weeks with Regional Dermatology, she reached out and said, Monica, you might want to talk about this. And I said, well, we have to. This is coming from all over the place, so we definitely need to discuss this. Before we get into that, you saw the video from the Ruby Lee concert. And yes, a lot of people have asked, how is my mom doing since her procedure she had on her heart? As you saw, she's dancing with me already. So I think that speaks volumes. She is doing wonderful, and she thanks you for all of your thoughts and prayers. All right, let me bring our guest in. Dr. Sarah Jensen again from Regional Dermatology, and Amy Laritz is a patient of yours, right?
Actually, she's one of my friends.
Oh, one of your friends. Okay, perfect.
Yes.
Well, I'm sure you've probably been to her as a patient too. So it was just ironic that you reached out and said that to me, and I'm like, we've got to do this. Let's switch some things around. So let's just start with this, because although we have heard of it, there are probably a lot of people that, as we're experiencing, not just you, but even a lot of physicians that don't know about this. So what is alpha-gal syndrome?
Alpha-gal is a condition where you get bit by a tick that's been exposed or bit another mammal, and you subsequently get a kind of an immune reaction to any kind of hoofed animal, anything kind of red meat like pork, beef, lamb, and you get an exposure to that meat, and then you can have hives, you can have stomach upset, you can get very sick, hours after the ingestion.
Right. So when my friend was on last year, she's like, yeah, I was like, wait, what? She goes, I can't eat anything with a hoof. And she's like, that's just pretty much how it is. Yeah, Amy's sitting here going, yep, that's what I have experienced. So let's go to Amy for a second. So when did you start experiencing problems?
It was back in 2020 during the pandemic when, everything was kind of crazy. And my family and I were doing more hikes and walks outside just as safe ways to meet up with family and friends. And I noticed a tick bite. I never saw the tick, but just kind of, noticed that I had a tick bite. And then weeks later, I would make something for dinner like lasagna, and I wasn't really connecting the dots, but hours after dinner that I was fine. But, when I'd go to bed at night, I had horrible GI issues and was up pretty much all night with very upset stomach, and it would I wouldn't be able to sleep. And then about 10 to 12 hours later, the symptoms subsided. I felt kind of miserable because I had been up all night. My stomach was a mess, but and I wasn't really connecting all the dots, but it happened a couple other times. And then I started to realize, I don't eat a ton of red meat, but I was like, wait, what have I had to eat? And when, I had a lot of time to do some Google research, and so I started Googling my symptoms, and I started to think, oh, well, it seems like whenever we have like meatloaf or lasagna or something like that, then I get sick a few hours later.
Phenomenal for you to have that awareness, though. I mean, again, I don't think a lot of people would put that together or even think it would be an issue. They would just be like, I don't know, maybe I'm bloating. You saw some of the symptoms that Zach put up there for you. The bottom right one said abdominal pain, diarrhea, nausea, vomiting. Again, you might have hives and itching and swelling. So you mentioned, and they're weeks to months maybe. That's the Lone Star tick bite also we're going to talk about in our second half hour. But you didn't notice the tick. Did you just see like a little red spot, or was it swelling?
Yes, I just noticed kind of like what would be a typical tick bite.
Okay.
And so I just kind of assumed that maybe there was a connection there. And then subsequently, I was able, after we kind of came out of COVID, I did a virtual appointment with my primary care doctor and kind of explained what I was experiencing. He said, yeah, I really think you have this. Just avoid those products until we can get you in. And I eventually saw an allergist who did a blood workup for very specific for the hoofed animals, and I came up allergic to that.
Again, if you're just tuning in, we're talking about alpha-gal syndrome and any tick-borne illnesses and just how dangerous this can be. Dr. Sarah Jensen from Regional Dermatology, as well as her friend Amy Laritz. Edward Boyer is going to join us in the second part of our segment, talking about alpha-gal as well as the Lone Star tick bite, as you just saw there. So, Dr. Jensen, if someone's experiencing these kind of symptoms, they don't want to wait because some of this could be fatal, right?
Right, because the hives can really be like a systemic effect where you can have anaphylaxis where you close your throat, you can't breathe. So it can be very serious. So we have a lot of patients who come in with chronic hives, chronic urticaria, and that's one of the labs we check. We didn't used to do a lot of a lab panel for many patients with hive because like maybe 10% of the time you can find a solution or etiology. But now we do the lab testing for these patients, and a lot of them come up positive. But Amy's story is very common. I find often when patients come in with a condition, I say, well, how'd you get the diagnosis? And I have found a lot of women who have had GI issues or maybe have had a rash and kind of get a little dismissed, I don't know what it is. And they've researched it themselves and asked their doctor, can you check the lab for me?
Right.
So I'm always impressed with people who do that kind of workup on their own sort of.
One of the things on this Medical Monday we've been doing for the last year is how much it's important for you to be your own advocate, because there might be some things out there as we're experiencing that there are some physicians that are like, what is this? Oh, and it's new. So how do we know how long ago has this kind of been starting to take over like this ad?
It's a good question. I'm not quite sure. I mean, I know just in, I think May, I think I had sent you the Missouri Health Department had sent out a notice to the hospitals to notify doctors in our area of just how prevalent this is. And I think they had quoted up to like 80% of doctors didn't feel that they had adequate exposure to really know what to look for, or to make the diagnosis. It's not a difficult test to run. And typically people will think about allergists, but really any primary doctor, any dermatologist, any, family practice doctor should be aware of this.
Yeah, this page that Dr. Jensen provided to me, it says that 78% of healthcare providers know little to nothing about what we're talking about today, alpha-gal syndrome. 78%. That's huge. That's not a good thing. But again, it's more and more awareness. Only 5% of healthcare providers feel very confident in diagnosing and managing alpha-gal syndrome. It is the 10th most common food allergen, according to the CDC, and up to 450,000 Americans are now estimated to have this. And it sounds like it's growing.
Right. And it's not just like the hoofed animals. You think about the red meats and all, but it's also like gelatin, the capsules. You might take a supplement. So you have to look for those like vegan, supplements if you're taking some kind of vitamin or supplement.
So if you were to say, whatever, I'm at a barbecue, I'm going to eat, would it just be an uncomfortable feeling, or could it get worse and worse?
Oh, it could definitely get worse. I'm sure you know better than I, but yeah, especially with the hives and the anaphylaxis, but the GI symptoms can be pretty severe.
Yes, I mean, I'm sure there's far worse things that people have to cope with, but yes, my symptoms are all GI things. So it has, once I kind of knew what was causing it, I just kind of eliminated those things from my diet and have not had any issues since.
Now, Dr. Jensen, let me ask you this, because when we talked about this last year, I was told that there was kind of a quote unquote shelf life, that maybe about 5 years, and then maybe you're lucky that maybe if you reintroduce it again, you could. Is that true?
It's true. You can go into remission with it. Some patients might introduce the meat, but I guess it depends on how comfortable you might be with it. Maybe small bits, but you can check the labs too and see if they've diminished as well. But I don't know, the time period for any one patient. I do know you have more risk if you get bit again, so that's an issue. You really do want to try to prevent those tick bites if you can, and it's tough in Missouri.
Well, I was just going to ask that, because a lot of people are saying, can you ask her if we're seeing more tick bites now or more ticks on our animals and on ourselves than we have in recent years? And if so, why? Where would that be coming from?
I mean, it sure seems like it to me. I don't know the data on that. I'd have to look into it. But I don't know if it have to do with like global warming, climate change, and their ability to, survive. I don't know. I'd have to look into that.
But one of the things that you got a question on last week, and let's talk about it again, to prevent this. The prevention is the key.
It is. I mean, trying to stay covered, wear your socks, long pants. I know that's tough in Missouri, these temperatures. Trying to use a spray with DEET in it, really can be helpful. And like I had mentioned, trying to spray like their clothes so you get more of it on your clothing than the skin if you're worried about the chemical. Those are the key
Yeah, we've got it up there. Again, covering up. I know it might be uncomfortable because of the temperatures like you mentioned, but I'll see my husband go out there to mow the lawn and he's in this big hat and long sleeve shirt, and I'm like, oh my gosh, I feel bad for him, but it is important. And so when you're coming from being out in grassy, wooded area, to check yourself, how important that is. Instead of just get out, get in the shower, and then all of a sudden, I mean, if that tick is on there for a long time, is there a tick on you? Do a tick check. You want to run through some of that?
Yeah, you do sort of feel all over. You can sort of feel the little bumps. Obviously, they get larger as they've been feeding. They do like crevices of the skin. So just doing a full check of you and your kids and pets too.
So I will give you an example. Last year, my husband, he used to have a foreign exchange student before he and I got married, and she came in to visit, and they had never seen ticks before, so they're from Belgium. So it was her and her husband and their little boy, and I was saying something about ticks, and she's like, a tick? And I showed it to her, and she's like, ooh. And then all of a sudden I go, oh, you have one? And she's like, what? And she freaked out. They had like 10 on them. And that was last year. I just think they're getting worse and worse and worse. But yes, you've got to do thorough checks. I found one yesterday and now I do the preventative that we're supposed to do on animals, but it was on my dog's eyelid. Oh, wow. And I was like, is that a tick? It sure is. It's a tick. Removing them is important. So we need to make sure that we get its head and everything out of us.
You do, because you can get kind of a tick bite reaction if you have like a little, foreign body particle still in the skin. And I do have a lot of patients who worry about that little bump that arises at the side. I mean, that can just be a tick bite reaction, not necessarily the full, immune response to the tick. So people do get nervous about if they have a little red bump, but that can persist for a few weeks.
Okay.
Now, if it starts spreading, that's a different story, or they start getting more symptoms, fever, chills, not feeling lethargic.
Yeah, so I know a lot of you are eating breakfast, and I'm sorry to be talking about ticks, but this is important for you to be listening to and watching, and this is a show definitely that I want you to share. So yes, when you go to pull them out, and then people think they can just throw them in the trash. We flush them down the toilet. Is that the best thing probably to do?
Probably. I mean,
because otherwise they're just going to come crawling right back out. You can't kill the darn things. They're frustrating. So we've got some comments. Kelsey, was there a good one coming in that you wanted to tell me about?
A good comment from Linda Eckert.
Uh-huh.
About hives, getting hives, and going to the ER.
So she's had that happen to her?
It says our friend will get hives.
She's saying that they said that their friend would get hives really bad.
Several trips to the ER before diagnosis, to the extent where he had trouble breathing. He cannot eat anything that may be fixed on the same grill with pork or beef.
Okay, so it's kind of like, I mean, I'm thinking that's like celiac disease. So like contamination of anywhere nearby, is that right?
My case, I don't believe is quite as severe.
That's severe,
I can
okay.
kind of just, pick things off and just avoid it. But like food preparation, I don't.
You haven't had that. But it can be just certain levels of it. Does it have something to do with our genetics as to how it would affect us?
It probably just he must have
unless he got bit a couple times.
Right, or just a robust immune response to it.
Yeah. Again, for those of you that are new to this, you're not alone. And we just told you that 78% of physicians are either just finding out about it or not aware of it either. So don't feel like you're in the dark about this at all. No dairy products with cows or goat milks for some as well.
True. Yeah. Yeah, that's definitely not in your case.
Not in my
but,
case,
right,
thankfully.
Yeah, right.
We'll have to find out, because we've got another guy that's coming in that's been dealing with this, Edward Boyer. We'll see what happens with him. So we mentioned about checking, but as far as preventative, so last week, a guy was asking about what we should wear. Let's go ahead and go back through that again. The bug spray that we should be putting on us and putting on our kids.
I just use a high concentration DEET. I had tried the more organic products, soybean oil and peppermint oils and all. When I had young children, I was worried about, their exposure to chemicals. But you really have to apply those hourly, and it's really just about the oil on the skin to try to keep the bug from kind of landing. So I've since switched over to the higher concentration DEET products, and of course we rinse them off when we get back home. We don't want those in the sheets or when they go to bed. But the high concentration DEET would be the best product.
And then it's also as much as you possibly can. I mean, I know you all want to go hiking and do different things with the kids, and you're in this tall, grassy area, but the best is try to avoid it, because we're talking about ticks being more prevalent. But also, how do we tick-proof our yards?
Oh, that's a good one.
That's
I leave the yard work to my spouse.
Honey, you do that. You better do a good job. So I guess it's just clear all the brush, clear the leaves, anything that's all standing together.
Keeping, the grass as mowed as short as you can, so you don't have that tall grass.
There you go. There's a good tick safe zone of what to do. But again, a lot of you are taking your kids out to area parks, and that's the thing, and you're coming back. But I guess the biggest thing that we can stress to you is check yourself, your kids, your pets, and then showering as soon as you come indoors.
Yeah, I would, just to get the chemical off as well.
Don't leave it on you.
And speaking of, though, I have some patients who are sensitive even to products that contain animal products in them. So people
gosh. Yeah, this is, but again, we're saying it from an inconvenience for some of you, but also if it could escalate, and we've talked about some of these things being fatal, you don't want to leave it on you. Alpha-gal symptoms, let's talk about that. We've mentioned that Amy dealt with having some GI issues, etc., but hives and itchy rash, one of those, nausea, vomiting, heartburn or indigestion, diarrhea, cough, shortness of breath or difficulty of breathing, a drop in blood pressure, swelling of the lips, the throat, the tongue or eyelids, dizziness or fainting, and severe stomach pain. So if you have these, you might say, wow, I just heard about this on Monica's show. Maybe I need to check this. So would they want to go in if they have these things right away and then ask their doctor to do some blood tests?
I would think so. I would definitely mention it. And you can see why doctors might, miss that, because that's kind of a broad variety of symptoms, right? That could just be like a viral, illness.
Absolutely. Yes, Kelsey.
Debbie Steigman said, I'm a magnet for ticks and have had a bad case of cellulitis twice already this year.
Oh, cellulitis also.
Wow. Yeah.
Yes.
Yeah.
Again, all of these things, there's so many variants, and we're going to talk with Edward. We're going to bring him here in just a second. He's dealt with something, but so has his wife, and she had a really high fever and then went in and did blood tests, and she actually provided some of those to me, and she's like, look what these guys can do, because it just lowered all of these amounts so bad.
Yeah.
But again, yes.
Ashlyn said, Edward Boyer says mowing your grass will help prevent ticks in your yard.
Yeah, mowing your grass. Well, your neighbors want you to do that anyway. So don't have them really, really high. It's also from the mosquitoes, which can be dangerous. And let's talk about your animals that are out there. If you do not have them on heartworm preventative, that's going to be dangerous to them. But it's about not having all this standing water.
Right.
That's where the mosquitoes are really bad.
Right. That definitely, clearing those areas is key.
Yeah.
And that's probably more important for like West Nile virus, which I haven't heard as much about lately, but I'm sure that'll, rise again,
So you first heard about this just recently, right? Didn't you?
With the alpha-gal?
Yes.
No,
You've known about it?
I've known for a little while, maybe the past couple of years, but it comes to me a lot from patients too.
Gotcha.
They've told me about how they were the ones who had to really research the condition. So I was really impressed with that, But
I'm impressed with you, not
yeah.
just dismissing the symptoms.
Right.
Because again, a lot of these mirror other things that are out there, and I don't know how many people would come back and go, oh, well, maybe I had a tick and I didn't know it, or maybe I still have a tick on me, right?
Right. Yeah. I think, like you said, it's good to be your own advocate and kind of do some research, try and connect the dots and look at your habits and see if you can find some of those connections, and then follow up with your doctor too.
Absolutely. All right, we're going to take a quick break. When we return, we're going to bring Edward Boyer in. We'll talk about what he's been through, and his wife actually as well, and not to dismiss these things. So a lot of you that are hearing about this morning, I want you to think back, maybe over the last couple of days or weeks, if this has been going on, to not dismiss it. Don't think you're crazy. It's okay to go in and say, can you run these tests on me? I had a tick bite. I didn't think it was a big deal, but these are the things that I'm dealing with. So when did you first get diagnosed before we go to a break?
Well, I noticed the symptoms in 2020, kind of had that video conference with my doctor during COVID. And then about a year or so later, I was finally able to get into my general practitioner, who then referred me to an allergist. And then I was able to finally kind of get the formal diagnosis through the blood work. But just that time, I have just been avoiding meat altogether. But it was nice to kind of get that confirmation that that's what I had.
But probably hard for you back then, because you were mentioning we were going through the pandemic. A lot of people couldn't get into doctors. You're doing video conferencing, and you're like, I'm lost here. I don't know what to do. So you're on the, 4.5 maybe year time period?
Yes.
You think you'll ever try to reintroduce red meat?
I was just having this conversation with my general practitioner a month ago when I was in to see him, and he said, well, it's kind of up to you. We can kind of run that blood work again. If you are really wanting a cheeseburger really bad, we can do that. He's like, but as your doctor, I would recommend that you cut back on those kind of meat products anyway. So for me, I'm kind of okay with that, so I'm just...
You can have an Impossible Burger.
Right, I can do, or the ground turkey is a big thing at my house. So, so I've just made that kind of a lifestyle option, and it's worked for me, so...
Absolutely. And my friend that had it last year, she's like, I don't miss it. And I said, well, it's easier on your body anyway. It's hard for us to break down animal products, and red meat's more difficult. So I've had some people say, not that you want it, but they're like, maybe I want that because I need my body to feel better. I'm like, no, just eliminate red meat on your own. You don't want this. Okay, Amy, thank you so much for coming in. We're going to take a quick break. We're going to continue with Dr. Sarah Jensen. We're going to hear the story from Edward Boyer and what he's gone through. Again, alpha-gal syndrome, Lone Star tick disease, other things. If you or someone you know has experienced any of this, I'm going to look at your comments right now. Drop them in. Ask any questions. We've got about another 20, 30 minutes or so that we'll be on. We'll be right back.
Come on, Monica. Let's go, St. Louis. Turn and burn.
Hello, Miss Monica.
Monica. Hi, guys. This is a good one. Sometimes you spend like 10 years and you don't got one like this.
Hi, Monica. It's a feast. It's like a 17-course meal. You're just like, you need a minute. With wine. With a wine pairing. And a whiskey pairing.
That is what. There it is.
I think I just have the most beautiful experience. I saw fireworks.
Thank you, Monica, for making our day.
Well, we've been talking about just how hot it is all across the United States, and so many kids have said, come on, Mom, Dad, can't we have one of those? That could be in your backyard. We want to congratulate, I think it was C. Lewis, maybe, or C. Smith. Definitely C was the first initial. The winner from this past weekend, they pulled a winner for the 30-foot round above-ground pool at Just Pools that they gave away, and 100% of those proceeds going to Find Your Rest Ministries and Tunnels for Towers. I love all of you that bought your raffle tickets and went in to support our friends at Just Pools and Spa. They're at the West Outer Road in Arnold. You can see not only the in-ground pools that are popular, but also that whole backyard oasis feel deal. So if you're looking for new tables, they've got some there. They've got the lawn chairs. Again, spa specialists as well. They are the authorized Pentair dealership. Just Pools. Again, on the West Outer Road, 3987 West Outer Road South in Arnold. Give them a call. Go in and get your chemicals. Get all those fun toys because we still have a lot of summer left. 636-464-7110. Madonna, thank you so much for being a part of the Real Monica Adams team. If you're just tuning in, it is 7:40. Welcome back. I'm your host, Monica Adams, and we have Dr. Sarah Jensen from Regional Dermatology in with us, talking about something that some of you have never heard of, but today I'm glad we're bringing awareness to it. Alpha-Gal syndrome, but not just that. We now have Edward Boyer with us, and he's going to talk about what they've been going through. So, Edward, thanks for joining the show.
Right, thank you.
I appreciate it. So you and your wife actually have been going through something. Let's start with you. So you had the Lone Star tick disease, is that correct?
That's correct.
And how long ago were you diagnosed with that?
That was in August of last year.
Okay, and so what started happening for you to know that, hey, I've got something going on here?
Well, on a Sunday night, around the house, we have about 65 acres right in town in DeSoto, right on the edge. And went for a walk, came back after about an hour, took a shower, found a tick bite, which I've done all my life. I've lived in that area all my life. Didn't think anything of it. Woke up on a Monday morning with 101 fever. Didn't think any of that. Took it. Tylenol and a Motrin. My wife was a retired nurse, so I'm doing that. Tuesday morning, had 101 fever. Wednesday morning, 103 fever.
Oh, no.
Thursday morning, 103 fever, and I'm getting in the tub. I'm doing that. So I go to Mercy Urgent Care, and about 11 o'clock, and we don't know what's wrong with you. But that was my fault because I failed to tell them I had a tick bite. So as you do this, you have to tell them. And my wife, we did the same thing just last week with that, where we didn't tell them the first time. The second time, we told them. But anyway, I proceeded to go back home on that Thursday with that fever. And I didn't get off the couch, and I don't sit on the couch. I did because it was that bad with the headache, the fever. It was just that bad. And we were watching a movie, and Lisa's nurse in her is constantly checking my temperature, and I had 101. Well, 45 minutes later, we went watching this movie. I had 105 fever.
Oh, my gosh.
And first thing, to the tub, cool off, do all that. And we happen to know a doctor, my doctor, Dr. Cadez, I'll say his name here. He's a great man, great doctor. And he was at a funeral, his sister's funeral in California. And Lisa, we have his number, and Lisa texted him or called him, and he knew right by. Our world today is so fascinating. People so smart, but he could see all my labs. He could see that. He knew what to do. He called me. You're taking this doxycycline right now. Where are you going? He called my phone personally. He had that, and I took it. And if it's diagnosed, by the next morning, that doxycycline my fever was gone. I felt good if it's diagnosed. But if you don't tell them, you talk about unawareness by doctors or whatever.
Right.
And depends on what area you are, I guess, because he evidently dealt with it in a rural area. But if you don't tell them you have a tick bite, they don't know to check for that. And some check for it, but they didn't, and I didn't, so it was my fault. But that fever, Dr. Cadez knew, and my wife, the nurse and her again, had researched all this, and I did not eat red meat. We didn't eat meat for 2 months because alpha-gal was the side effect of this Lone Star tick disease is what they call it, or whatever the medical term is. But we didn't eat red meat, and it's okay because we eat a lot of seafood, but I love my steaks. That's
the thing. Oh, look, Edward, there's a lot of guys going, I do not want this, because we know that men love their meat and potatoes, but you cannot eat it anymore, or at least for maybe a 5 years or so period. So let's bring Dr. Sarah Jensen in about that. So that's the biggest thing. So we just mentioned earlier, and I know a lot of you are always tuning in every second. You may have missed the first half hour. I mentioned earlier that 78% of physicians don't know or have only heard a little bit about this. But those that do, the 22% that do, and she was one of them that's known about it for a couple of years, you would hopefully, maybe if you're seeing these type of symptoms, ask that question. You're shaming yourself and saying it's my fault, but I mean, the patient, they're not going to think, I had a tick bite. Is that a problem? Right. Oh, wait. Let's shift gears here. But I would hope that as we're getting this out there, that more physicians will hear this and say, let's ask this question and help the patient along.
Right. I mean, you can see but your symptoms, I mean, you might think about COVID or a viral, infection. So it is tough. But luckily in dermatology, I see the issue. I see the hives, the rash, And so that's what helps me. Or if it was like a Lyme, I'd see the, targetoid, like bullet, rash that kind of expands. So that helps me because I can see the pattern. But these symptoms are so kind of vague. It is hard to know.
That's the biggest problem I think a lot of patients feel in medicine. They're like, well, this mirrors this and this mirrors this, and I'm so confused at what it could possibly be. But the message is, don't leave it alone. No matter what it is, you've got to get it taken care of.
Right. And I have had patients who've had the positive alpha-gal test, but still been able to eat meat. So just because you have the test that's, and you have this immune response, they still can eat meats. And I don't know, we don't know why that is the case. Yeah.
Well, you're one of them.
And I'm one of them because we didn't eat meat for 2 months. I introduced a hamburger and mine tested positive. I had alpha-gal in my bloodstream, but I can eat red meat. I can eat everything now.
Well, aren't you lucky?
And what a great world
Edward
we live
Boyer
in.
again. Kelsey is in here with us. Kelsey and Ashlyn, part of my team. We have a question coming in?
Julie asked, could you please put up the symptoms? My daughter's boyfriend had a tick last week.
Okay, can we put the symptoms back up again, Zach? So her daughter's boyfriend had a tick last week and maybe is experiencing some symptoms. We talked about these symptoms earlier. Hives and an itchy rash. Are you seeing a lot of that come into your offices?
I do. If someone has hives for over, we usually wait 6 weeks because that's considered like chronic urticaria, chronic hives. I'll check earlier if they're really uncomfortable or if we can't clear them with a little prednisone or what have you. But because anybody can get acute hives, you can get it to an illness or to a medication due to stress. So I'll wait a little bit, and if you can't cure them or make them better with the prednisone, we'll check the blood work as well and see if they turn up positive.
And so when you do the blood work, what is showing itself at that point?
Oh, well, typically I will just check the alpha-gal, maybe some basic labs, a blood count, a liver panel. But typically I'll see, you might see their eosinophils. Those are in your blood count, and those are cells that are more present when you have an immune response or some kind of allergic reaction.
Okay. Again, don't dismiss this. And I don't know if you know the answer to this, but for kids, for adults, for seniors, is it the same across the board? Are there some people that are more at risk and it could be more dangerous?
That's a good question. I'd have to look into that.
Okay.
I don't think it's prevalent enough that I've had to actually go that into depth. You know, I've maybe had less than a handful of cases that I've tested that come up positive.
Yeah, I think a lot of people just think it's a nuisance and like, oh, it's a tick. But we're trying to stress to you this morning that no, this could be extremely dangerous to you, and to not just dismiss it and not go to the doctor. I mean, his fever's spiking and not going away. It should be an awareness, which obviously the two of you experience. Lisa, his husband, is sitting in here with us, cheering him on. Good job, Edward. Yes.
A guy that works for us, his dad, and I've known him for years, and it's happening more and more around our area to get it. He ignored his fever. That's why Dr. Cadez said, you're going to the hospital if it doesn't change. His dad ignored his fever, and he was probably about 3 years, probably 68 years old. His kidneys started shutting down. He was in the hospital for 2 weeks because he had this Lone Star tick disease, ignored the fever like I did, but went longer than I did, and then it moved to his internal organs, and he was literally in the hospital for days, or weeks rather, 2 weeks.
Yep, I've heard a lot of stories like that because people are dismissing it. The other thing is, if you don't have a good woman behind you, that men don't want to go in. I mean, I literally heard this past weekend where these guys that we were around said, well, we don't want to go to the doctor because we don't want to hear bad news. And I said, but you don't want to live with the bad news. Right. I think I asked you that last week. It's like, guys need to go in, girls need to go in. We both need to go in, but a lot of times it's the woman saying, as they kick and scream, to drag them along with us, right?
Right. And the news doesn't get better the longer you wait.
No.
You can be very preventative,
Well, prevention is key. That's the biggest thing that we were saying. And we mentioned earlier what to put on you. I had someone that invited us over this past weekend for a 4th of July party. And here's a prevention, by the way, of alpha-gal. They were saying that they fogged the front yard and made sure that they are trying to keep away the ticks, etc. But it was more on the natural side, which you and I mentioned last week.
Yeah.
But the best, if someone's trying to take care of their yard, what would we maybe go to the store to buy?
Oh, to the yard?
For the yards. What would you say?
That's a good question. I just typically try to keep the grass mowed and keep it short,
Conservation Department actually told me that. I asked them, how do we stop this? And they said that ticks are typically 18 inches off the ground. Taller grasses, They said keep your yard mowed, but the Missouri Conservation Department said mowing, keeping your weeds down, weed eating will prevent ticks, will help prevent it.
So those things that we see at like Lowe's and Home Depot, or whatever, do those help? Do you have anybody know that's actually in the audience, or is it just a marketing thing?
I would think it works. I mean, you see all that, and you can typically, if you use chemicals, some people don't.
They don't want to be in chemicals.
And you have pets, and you have everything else, so.
And then you might end up having a problem with the chemicals in the yard, right? It's this,
Right.
You're like,
Vicious cycle.
Yeah, it's a horrible vicious cycle. Again, we are talking about alpha-gal syndrome, and it might be the very first time that you're ever hearing about it, and that's great. I'm glad that we're able to bring this awareness, Lone Star tick disease, and other things that are out there to you. Love the questions and comments coming in. Yes, Kelsey?
Linda said, I wonder too if it's certain areas more than others. DeSoto is close to Bonne Terre, and I know 4 people with this.
Yeah, I mean, maybe more rural areas.
Yeah, more foliage,
Yes.
less concrete, I
Yes.
would imagine, yes.
Yeah, so I don't know. That would be something that I would love to look into, to look at more of our rural areas and look into the city, and maybe they'll be like, nope, I'm not around. They don't have a lot of grass. They got more concrete, or they have small little patches that they're growing and that they're mowing. So yes, it is to look for all of this. When someone has a tick, maybe you haven't had to deal with much of this. It's just a little bit of a redness that comes around it, and it's itchy.
Right.
But it shouldn't grow.
It shouldn't kind of expand. Yes, people get nervous. They see me when they have a tick, sort of a bump where the tick was removed.
Right.
Worried that there's and there can be some foreign body left. Usually that'll work its way out. But it's that expanding rash. But not everybody has a rash. Like we talked about that. Not everybody
didn't have
will
a
show
rash.
Just a typical tick bite. Had them all my life. Lived
Right.
in that same area all my life. Never had it. But
See, and that's the problem, is that people will be like, yeah, whatever. But the fever is the thing that would scare me.
it's not a bullseye like they told you with the Lyme disease. It's
Right.
not. It's just it looks like just a tick bite. And next thing you know, I wake up with that fever.
Let me ask you this, because I remember, and my mom was so mad at me. I think I was in college, and I had something. I don't know what it was, but then a red line started to form.
Oh, right.
And she was like, "Why did you leave that go?" Well, it stopped eventually, but she was like, and it's going directly in towards your heart area. So if someone even begins to see even a little bit of a line, go in
That's-
right away.
Yeah, that's called streaking, we call it. You know that in medicine. And so definitely you worry about infection. So you'd want to see someone, maybe consider antibiotics. And it's
Okay.
such an easy treatment, really, for a lot of these tick-borne diseases. It's like 10 days of doxycycline. It's pretty straightforward. So it's an easy, cheap treatment. So even if you have the concern, sometimes we'll treat. You
Yep.
can get the lab work later, but you want to treat and make sure.
I was just a dumb kid. I was like, what? What is that? Types of tick bite related rashes. Again, Edward was just mentioning that. We see the bullseye one. The Southern Tick Associated Rash Illness, nearly identical to the EM rash. You were mentioning, Dr. Sarah, the top left one. Is it erythema?
Erythema.
Or
Erythema, just redness. It's just
Redness,
fancy
okay.
word for redness.
Or Lyme
Migraines.
disease rash, looks like a bullseye in most cases. We haven't talked about this in a long time. Rocky Mountain spotted fever.
Yeah.
When's the last time you've seen something like that?
Probably in residency, which was about 20 years ago.
Yeah.
Yeah.
Small, flat pink can later present as tiny red or purple spots. What's the one on the bottom there?
Ehrlichiosis, and that's another tick-borne disease, yeah. And I don't know that I've ever seen that, but I know we do check it. It's one of the tick panels. And then there's tularemia. So there's you can get a whole panel for these these tick bites, and these are all included in that.
Tularemia. It says you may see an ulcer forming at the bite site.
Right, yeah. And I don't know that I've ever seen that in my...
Well, that's good. Keep it out of Missouri and Illinois.
I definitely would have seen the erythema migrans, that expanding rash. So it's kind of like a ring, and then it's clearing in the center. So once you see that, you don't forget it.
Again, these are things that we're seeing right now. We continue to see ticks through fall, and then maybe
Right.
they start to go dormant in wintertime and then come back probably 3 of the seasons throughout the year, don't we?
And we haven't had very cold winters lately.
No.
It feels like they're much milder. So
Right.
that might have something to do with it. I don't know.
So ticks, mosquitoes, chiggers. Do you still see chigger bites?
Oh, we see plenty of
Really?
chigger bites, yes.
Now, I remember when I was a kid, my mom used to always say, check for chiggers. You want to talk about those? Because some people are like, I haven't seen chiggers in a long time. Where
Chiggers-
do they normally form?
Those are usually I see them on the lower legs, but they can go all the way up to the hips. Just depends how deep someone's gotten to the woods. We had a bad exposure just recently, a couple of years ago. My family, they were playing a frisbee or something, and they ended up in the
Really?
brush. Yeah, and so they were just covered, and so those hang around for quite a few weeks. They're just pretty miserable.
I remember my mom used to put some kind of clear liquid something on us. It was like sticky.
Yeah, people also talk about clear nail polish.
Yes,
now,
that too.
I honestly have just given a shot of prednisone to those patients, and they do very well because they're pretty miserable.
Yes,
there's not much Benadryl. You could try, but otherwise, it's pretty miserable till they work their.
I think the problem I've seen is in the kids or things like that. They get one, they scratch it.
Yes.
They don't treat it, and the next thing you know, they've got bites all over them that are trying to heal with
Right.
clear fingernail polish we keep and use as soon as I get a chigger, and we get chiggers all the time, but it
So
never
it
gets
doesn't
past
spread.
one because I put that fingernail polish on as soon as I come out of the woods.
Yeah. Chiggers, again, let's just like knock on wood somewhere because I haven't seen those around in my particular area. No one's been talking about those, but they seem to be so bad when we were kids. And we also, what was the thing when kids would play in the sandbox and they used to say to beware of, like, because animals would pee in there.
Oh.
Do you know what?
Was it is that from cats as well? Is
Cats.
that toxo?
Anybody know what I'm talking about? If my mom's watching, she would say, no, stay out of that because cats and dogs would pee in it.
Yeah.
But the kids would want to play in the little sand area. And they
Right.
had some of the sand areas in like parks. Oh my gosh, what was
Is
it called?
toxoplasmosis? I think.
But there might have been another street name for it.
Oh, sorry. Yeah, sorry.
Because that I wouldn't have said. Oh, gosh darn it. Anyway, somebody that might know, let me know. But we're talking about all these things while the weather is warmer and all these things to be aware of. So if you are experiencing anything, just don't dismiss it. We can't stress this enough to come in from being outside, playing around, the dogs playing around, your kids playing around, you mowing, doing all the women that are out there gardening and landscaping. I know that I was back a couple years ago landscaping by our pool, and I'm like, I wasn't even out, but they were all around by the bushes,
right?
And came in, and I had like 3 of them on me, and just your fear right away in your mind is, oh my gosh, I hope they didn't bite me. But at that point, that's when you should start paying attention. If you've seen the tick, I think it's just this immediacy of, if you're going to the doctor, hey, I did have a tick, and then maybe that right away will shift gears for the physician.
Right. Yeah.
Good. All right. Ooh, and aren't they ugly? Ooh,
Yeah,
they're just gross little things. All right, I'm going to take our final break here. Lone Star Tick, we're talking about Alpha Gal, and look at all those. Gosh, those are huge. All right, I don't want to see those anymore, Zach. Get them off the screen. Because I swear, does this not happen? As soon as you see them, you start to itch. It's just, it's like sneezing. It's an immediate thing afterwards. Do we have a question? We have 2 questions, okay? Okay. Well, I tell you what, let's take a quick break. We're going to get those questions and comments, and if someone can remember... Oh, I almost had it. If somebody can remember what it is in the sandbox before I wrap up the show, please let me know, because it was something my mom always... Wait, it's on the tip of my tongue. I hate this. Let's take a quick break. Let's see if I can remember when we return. Need women to lift women up.
Let's do that. Let's go. Being on Monica's show, it was like one of the best interviews I've ever had.
Monica's very real, and she really cares about people.
She's changing lives.
Changing lives.
I think this is just really what people want to see.
Giving back so much to the community, and I really appreciate it.
Today, Monica was extraordinarily real, not only with me, but with her viewers and her listeners.
Made the interview process like talking to a friend.
How are you doing? See you. Haven't seen you in a few weeks.
Hey. You're close.
Monica. Whoa.
So go out in this world and be anything you want to be. But before you do that, first, be kind. And welcome back. It is 7:59. Just talking about all these different crazy symptoms from ticks and mosquitoes and chiggers alike. We're bringing awareness so that you can hopefully prevent these things or get into the doctor as soon as you can. All right. I phoned a friend, and that friend is my mother. I asked her really quick, what is it? So she thought it was infantile, but we're going to ask the expert, Dr. Sarah Jensen from Regional Dermatology. It is called what?
It's impetigo.
Like IM?
IM. Yeah.
Impetigo.
Uh-huh.
So
And
what
it's really,
is that?
It's really just a bacterial infection, like cutaneous, like superficial in the skin, and we see it a lot. You know, you can
Still?
Oh yeah. Yeah.
And is it from animals urinating
It's really
in something?
like any kind of like staph infection. So yeah, you can have like blisters. You can have just the kind of a crusted rash. Usually it looks a little, we call it like honey crusted. In medicine we often use like food terms, but to me it looks a little bit like honey crusted or
Okay.
Yeah.
Yeah, it is gross. So my mom would always be like, stay out of that. Kelsey, what are the questions and comments coming in?
Okay, Marilyn said, back in the day when we got bit by a brown recluse spider, my mom put an onion on the bite.
An onion on the bite. So I know she's just off mic, and I'm going to try to repeat some of the things that you said because you probably can't hear her. Marilyn was saying that when she was younger, that they got bit by a brown recluse. Okay, and then what happened?
She said that the doctor said that saved the skin area by pulling out the poison. Would that apply to tick bites?
Okay, well, putting an onion back then on the spider bite, they want to know if putting that on a tick bite would. Have you heard anything like that?
I do integrate.
You know, there's all these home
dermatology,
remedies.
but yeah, that one I've not heard of, so I'd be interested in reading up on that.
I'd rather you not take something out of your refrigerator. I'd rather you get to the doctor right away. Okay, what's the second?
And Miss C said, should you save the tick that you find on your body
Good question.
in case you develop symptoms?
Okay, so Missy or Misty?
It's Missy.
Missy. Okay, Missy is asking if you should save the tick, just like we've been asked sometimes to try to see if you can take a picture of or save the spider that bit you so that they can come back and say, oh, it was this or it was that. Is that a good, because we showed, I don't want to see them anymore, Zach. We showed all those pictures of the ticks. Should we be saving?
I have had patients bring in ticks or bring in a spider or the photograph, and that can help. But I think kind of
You're such a brat, Zach.
Just broadly in the back of your mind, you're going to think about those tick-related diseases, and so I don't know that it's necessary for sure. But
I wouldn't bring the tick in because they don't die.
Yeah,
it would still be crawling around.
We've seen them in like a little baby jar, but it's not very common that you see it. You know.
Well, I understand the difference in from a spider standpoint, but with regards to ticks, do we need to see different ones?
I honestly don't know. We learn more about the ticks for our board certification, those tests. I don't know that I'd recognize them. I'd just have to go look them up.
Yeah.
But I'd be thinking about all the tick-borne diseases regardless.
Yes.
So, you know.
And you'd be running the blood test.
Right. And this is a large panel, so you'd catch all of them in that
Take
lab.
a picture. Don't bring them into the office. But people do get scared about spiders, though, and they always. What do they have on the back of them? The ones that are the brown recluse? Does it look like a violin or something like that? It's a violin. You think so? Yes. Good questions coming in, folks.
Yeah, that might
Crab.
be the black widow.
The black widow.
Yeah.
The brown recluse looks like a crab, doesn't
Yeah.
it?
Looks like a crab.
And
Don't quote me.
Edward said it looks like a crab. What are the questions?
Linda said, is it a particular type of tick? I've had 3 seed ticks during this so far.
Ticks
Yeah.
doesn't bother me.
I haven't heard about seed ticks being the problem. Yeah, it's those larger ticks, those brown ones that we get on our skin.
So it's not the little
Yeah,
babies.
yeah.
They're just gross.
Yeah.
Any others? Good questions, folks, and keep them coming in, by the way, because Dr. Jensen does a wonderful job looking at the comments and responding back. If she doesn't see it, I'll tag her in it or I'll text her. But yes, keep this going because it's still only 8 o'clock in the morning, and I know a lot of you might still be just getting up, or maybe you had to run off to work and you only saw bits and pieces of this. Share this with your family and friends, and let's bring awareness to this and to not dismiss it. That's what's very important. So let's bring on the screen where you can find our wonderful Dr. Sarah Jensen, Regional Dermatology, 2 different locations. You can go to her offices in Chesterfield or Festus. We'll leave those phone numbers up there for you. So there's 2 different sets of numbers that you can call to set up your appointment, and the hours on the screen as well. For Chesterfield, Monday, Wednesday, Friday from 9 a.m. to 4 p.m. And then for the Festus location, Tuesday through Thursday, 8 to 5. And then on Friday, 8 to 4. I want to thank those of you that already have gone in, and I was told, actually was sending text to Dr. Sarah over the weekend, and I said she's getting rave reviews from our viewers already. So thank you for taking care of them, and thank you for getting them in, because a lot of people were saying that it was like 6 to 8 to 9 months to try to get into their dermatologist, and that is not the case with our wonderful Dr. Sarah Jensen. There's a view for you, by the way, of their offices. You can see them like I did. I wave. You ever see me waving? Say yes.
I'll keep a lookout. Yeah.
As we go by, but beautiful offices. So if you've been wanting to get into a dermatologist and you haven't been able to, or your current dermatologist can't get you in for a long time, well, we don't want you to have to wait any longer. Get in to see her. Thank you to not only Edward Boyer, who's in here right now, but to Amy, who just left, for sharing her story. Dr. Sarah Jensen. Okay, you know we always end the show with a devotional, so what color are you feeling today?
Oh, gosh. How about the yellow?
The yellow.
Yeah.
All right. We are going to do 100 Days to Freedom from Shame. See, it's so eerie how God always picks these, because Edward just faulted himself earlier, which is normally affiliated with shame. He said, shame on me for not thinking about the tick bite. It's okay. We're going to talk about when is sin not a sin. We'll do that to wrap up our show when we return.
She's a special woman and done so much for St. Louis.
Watching her work is one of the most incredible things you can see.
She just sees value in everyone.
Sometimes people just need you to sit with them and hear them. I feel heard.
The time flew by, and it was like sitting and talking to a friend.
Not only creating a better place here in St. Louis, but to inspire others. It's always great to have examples like you.
You have such a light and such a presence, and I could feel it this morning.
We knew right away when you started this, we wanted to be on your show. Thanks for having us.
I look forward to seeing how you rock and roll and shake it up.
Welcome back, 8:06, as we wrap up When is Sin Not a Sin? This is from 100 Days to Freedom and From Shame. We're trying to pull these out of your life. Depression, fear, anxiety, anger, overeating, and then this one, shame. If we claim to be without sin, we deceive ourselves and the truth is not in us. That's from 1 John 1, verse 8. You've heard the children's joke, when is a door not a door? When it's ajar? Haha, of course. So when is a sin not a sin? When we convince ourselves that it isn't. One of the most astounding abilities people have is to rewrite history, or at least reframe it to leave a different impression. We've seen politicians play spin doctor, but so do people who've been caught in sin. The first step is to change the wording. Dispense with lingo such as sin or disobedience and unfaithful, and start using words and phrases such as stumble, an error in judgment, and a moment of weakness. And if you really want to inspire sympathy in people around you, talk about how you were under attack from Satan. Who doesn't feel sorry for someone under attack, right? After shifting your language as you creatively rewrite the event, next you need to adjust your attitude. Instead of acting contrite, you must act wounded. That person you cheated with, he seduced you in a weak moment. That drunk driving charge you got, you had no idea the punch bowl at the party was spiked. See how it works? Oh, wait, you probably already know this. You've seen events masterfully reframed and probably have even done it yourself. In today's verse, John is saying, don't even think about trying to excuse yourself. The only person that you'll be fooling is yourself. Overcoming shame requires brutal honesty, right? Because no matter how skillfully you spin what you did, deep in your heart, you'll know you're a liar. Paul David Tripp said, we are all very skilled at presenting the logic of the argument that what we have done says more about the flawed people and dysfunctional things around us than it actually does about us. So we'll leave you with today's prayer. Oh God, search my heart to see if there is any dishonesty in me. Convict me of the sin of trying to pretend I am a victim when I know full well I'm not. Right? We need to take more responsibility for things. But we're trying to get you away from saying shame on me or shame on them. What a great show. Again, please do us a favor and share, like, follow our live streams every day, Monday through Friday at 7 a.m., always on Facebook and YouTube. And then we include Instagram and X and Rumble as we get into Wednesday, Thursday, Friday. We also have our great podcast on Thursdays when we drop a new audio. And we've had really wonderful ones. Tammy Holland, who I had on last fall, and we did a little update for you. She's going to be on the audio podcast this coming Thursday. Love having you with us every day. Tomorrow, really powerful show. We've got a woman coming in, and I have to thank our intern, Ashlyn, for turning me on to this story. KSTK, actually, my old TV station, did a recent story on this, and since they did the story, the person who took this young girl's life has been brought into custody. What I wanted to do is remember her life. That doesn't happen often. You just hear about the horrific and brutal things in the news, but what about the person that was lost? That's what matters to me. Let's honor her tomorrow. We'll do just that, so I hope you can tune in. Thank you so much. Remember, go out, be anything you want to be in this world, but before you are anything, be kind. God bless you all.